Yes, good morning, ladies and gentlemen. My name is Paul Zubail, and for those who don't know me, I'm the representative of the Federal Ministry of Health, and I'm very pleased today to welcome you to another session of the Policy Track. For those who don't know, the Policy Track is a new format at the World Health Summit that was initiated by the Federal Ministry of Health. And the advantage of it is that it brings the most current global health policy debate from governing bodies to Berlin, making it accessible not only to policymakers, but also to a wide range of actors within the global health community. Today, I'm extremely honored to open this session under the policy track, which is the HIV pandemic. I think it is the most fundamentally shaped global health pandemic in the last 40 years. It continues to be one of the main public health threats. And today, this goes without saying that the Federal Ministry of Health is one of the key supporters, not only of UNAIDS, but also in the fight against the HIV pandemic. Even though the states and the global health community predominantly focused on fighting the COVID-19 pandemic in the past months, I think we must not forget the silent pandemic, such as the HIV and AIDS pandemic that has ravaged communities for more than 40 years, and that must not be forgotten. As we unfortunately have not been able to achieve the 2020 UNAIDS targets, we need to step up and to see how we realistically can, in fact, reach the 2030 agenda of ending AIDS by 2030. And as Winnie Byanyima recently said at the United Nations General Assembly, even in spite of all the setbacks, we can end AIDS by 2030 if the world comes together, but it also says an if. Therefore, it's my great pleasure today that at this year's World Health Summit, we actually put the big challenge on ending AIDS on the stage here today. And we also look what's needed beyond 2030. Various events on HIV and AIDS in the past have primarily dealt with contemporary challenge on the pandemic. However, this session will follow a little bit of a different approach. We're not only analyzing what needs to be done, but we also look at the post-SDG era. So our panelists will question the current policy on ending HIV and AIDS, and not only providing an outlook on what needs to be done by 2030. So without losing too many words, I'm really curious, as much as you, to learn more about how this goal can be achieved. And therefore, I'm very honored to actually introduce our distinguished panelists and our moderator, our chair today, Dr. Christoph Ban. Dr. Christoph Ban is not only a very seasoned senior expert on HIV with a strong practical perspective, he's also been the Director of External Relations for the past 16 years at the Global Fund. With this, I would leave it, and I look forward to an exciting discussion. Over to you, Dr. Ban. Thank you very much.
Thank you so much, Mr. Zubail, for the kind introduction. And really, first of all, congratulations to the German Federal Ministry of Health and UNAIDS for organizing this really kind of innovative and interactive session. Very much looking forward to that. You will see that this is really meant to be very participative from the audience in the room and online. And it's part of the policy track. That means it's not just meant to be a nice discussion, but also to lead to some recommendations that could be relevant both for the ministry and for UNAIDS for the future. And I also think, it's very interesting and challenging to kind of ask all of us to look ahead 10 years from now. I think we are so used, particularly these days, to look at the immediate kind of challenges, particularly around COVID. And maybe if it was with you, like with me, when I looked at that and said, really, let's, suppose we are in the year 2031, can we do that? Isn't that kind of too visionary? But I think that's exactly the right, point of departure. It is good that we take a longer term perspective. And then to think historically, we are now in the year 2021. So it's exactly 40 years ago that AIDS was first described as a new disease. It is 25 years ago that UNAIDS was created, 1996, also the year when the highly effective antiretroviral treatment, was first announced at an AIDS conference. 20 years since the creation of the Global Fund, and now roughly 10 years away from the year 2030 and the goal of ending AIDS as part of the SDGs. And 10 years always looks like a long time in normal life, but I can tell you, as I've been also working on HIV for more than 30 years now, 10 years is not such a long time. It passes pretty quickly. And therefore it makes sense to think, where will we be 10 years from now? So thank you, the organizers, for challenging us with that particular question. And I think we really have an exceptional panel here with us. And let me introduce the panelists briefly, starting with Winnie Banyima. Winnie, thank you so much for joining us from Geneva this morning. We are really honored that you took the time to join us for this panel. Winnie doesn't need much introduction, Executive Director of UNAIDS, of course, but also previously the CEO of Oxfam International, and has been a kind of champion for equity, justice, gender equity for many, many years. So we are honored that you're joining us today for this panel. But then also, we have other distinguished panelists. I would like to welcome in particular Grace Febingulube from Malawi, who is a counselor, frontline health worker in Malawi, a person living with HIV, has kind of experience, of course, herself, what it means, also what it means for a country like Malawi. And she will share with us also later on some experiences with the international organizations we are discussing here, the Global Fund and UNAIDS. Then very much welcome Michelle Kazachkin. Professor Kazachkin, well, also doesn't need any introduction in the HIV AIDS world, has been an eminent scientist, from the very, very earliest days in the 80s. And then, been working as a scientist, as a diplomat, and as the executive director of the Global Fund for several years, where he was my boss. And I'm delighted to welcome my former boss here today on the panel, and look forward to your always very thoughtful contributions. And Professor Hendrik Strick from the University of Bonn, also an eminent scientist in the field of HIV AIDS, has done a lot of research on that. He's also co-chaired AIDS conferences and so on. And for all of you who don't know, but I am German originally, although I've been living abroad for many, many years. But I'm German enough to know that Professor Strick is very well known in Germany. You have been very prominent, in the response to COVID in the media with many kind of research and statements. So we are delighted to have you here today as well on our panel. Welcome, everybody. As I said, this will be a little bit different format. And before, I ask my first questions, I welcome all of you online and in the room also to kind of, post questions. I will see them here. You can raise them at any given time, and I will refer to that later on. But there will also be the opportunity for voting. And I have to give you the instructions how to do that. You have to take your cell phone and link up to the Slido system. I can see some of you are scanning the QR code. And there is also a way to register. Sorry that, I'm struggling to find there's a registration number that you need if you're not using the QR code. But it's here on the screen, the 260264. So it would be great if you can all register to that so that you can vote on some of the questions that we will ask, throughout this session. And may I ask the regie to kind of post the first question where we will ask all of you to vote on. That is the question that is coming up. Do you see an important role for the global institutions, such as UNAIDS and the Global Fund, after 2030? Yes or no? Simple question, but with quite some implications. And after about 20 minutes, I will show you the result to this question and then move on to the next question. And I can't help but to also comment on the distinguished audience we have here in the room. It is not a huge crowd, but in addition to the panelists, I would like to recognize also Anders Nordström, the kind of Swedish ambassador for global health, and formerly the very first executive director of the Global Fund in the year 2002. Delighted that you're here, Anders. And also the executive director of the International AIDS Society, Birgit Poniatowski, is in the room. So we have a very distinguished, not only panel, but also audience. And I hope you will also participate later in the discussion. And I hope I'm not forgetting any eminence in the room who might also be there. So please go ahead and vote on the first question. And then I would turn to Winnie, with the first question to you. You are the executive director of UNAIDS. You have been spearheading the high-level meeting on AIDS at the UN earlier this year. You have initiated the process for a new strategy for UNAIDS. So first, the question to you, where do you see the AIDS response 10 years from now? And also the role of UNAIDS in there. So we would be very interested to hear your perspective on that first.
Thank you, Christoph, and greetings all of you from Kampala at my home. This COVID pandemic has given us opportunity to work in new ways. I'm so happy to be joining you in Berlin, but from Kampala. Let me start by recognizing Germany for its leadership and its investment in global health, and for being a real ally of people living with and affected by HIV. Germany, for your continued support for the AIDS response and UNAIDS, and also the Global Fund. This is a legacy of Chancellor Merkel, also Minister Spahn and his predecessor. It's a proud legacy. I look forward to continuing to work in partnership with the incoming government. I also want to thank, of course, Grace, Michelle, Hendrik, and Paul for your leadership in this work. I'm so glad and honored to be on the panel with you to discuss the vision for AIDS, for the future of the AIDS response for 2030 and beyond. I don't think that I want even to address the question of UNAIDS. This is just a small bit. I want to talk about the response, where it can be, or where we could be in 10 years' time. We are at a moment of pandemic reckoning. Where we will be in 2030 will depend on how we execute the vision of tackling the inequalities that drive HIV. This was stated at the high-level meeting on AIDS in June and put very clearly in the declaration. By 2020, HIV treatment reached a number many said was impossible. 27 million people, 3/4 of the people living with HIV were on treatment. That was remarkable. With comprehensive prevention in some communities, HIV is a retreating threat. That is the most exciting part of this. But averages hide very important truths. Many of those at highest risk of HIV are not in that 3/4. That's why we didn't reach the 2020 goals. And that's why new infections are not falling fast enough. Prevention and treatment technologies, health services, and human rights remain unequally distributed. Now we also face colliding pandemics of HIV and COVID-19. So it is time for the next reset. We are in a new context. We must think boldly about 2031 and the AIDS response we need to get there, having ended AIDS. Our vision is that every country, every community focuses on closing those inequalities that drive their pandemic. And we know that it's different in different regions, in countries, within countries. These are rooted in economic injustice, gender injustice, injustices to key populations, unequal access to services. If we ensure that the marginalized groups do as well or even better than the advantaged groups over the next decade, we can end AIDS worldwide. But it has to be a focus on those who are unequal, who inequality crushes and leaves out. Our main responsibility will be also sustaining affordable treatment for millions. In a second scenario, we also prioritize new science, and secure an HIV cure and or a vaccine. COVID-19 has shown that much is possible. It has raised our hope. So we will need a massive effort towards eliminating the virus itself. We must put more effort in the science. But let us also consider a scenario in which HIV inequalities are only partially addressed. What if many, if not all, countries and communities do the hardest work? 10 years from now, many will see HIV as a pandemic of the past, while it continues to rage among people at the fault lines of society. A cure or vaccine will not have reached everybody. AIDS deaths will continue for some, while disappearing for many. We will still need means to continue the fight to end AIDS for those who are on the margins. Different scenarios require us to plan for different responses and capacities, but I am a pragmatic optimist. That is why I was so keen to be part of this panel. To be bold, to be ambitious, but to be very realistic about how we will all work together to end AIDS. It is possible, but these scenarios and looking at approaches to achieve the best scenario is an important piece of work. So congratulations on the panel. Those are my initial thoughts.
Thank you so much, Winnie. Very, very helpful as an introduction. And I think you already mentioned two of the key themes that we will follow throughout this discussion. The question of inequity and equitable access to all the kind of tools that we have in the fight against AIDS. And you've, of course, been a global champion in reducing inequities globally on AIDS and other issues. And we'll go a little bit deeper into that now. And I would like to turn to you first, Grace. We can talk about, the big institutions and global policies and so on, but you're living that, experiencing that every day in Malawi. And you would have seen probably a little bit of both kind of scenarios that Winnie described. We have made great progress, right? I mean, access to treatment has improved, access to prevention as well. We have these trajectories about how we are approaching the goal of ending AIDS by 2030. We know where we are on track, and we know by now we are not on track anymore. Where do you see that also going? If you imagine 10 years from now, the kind of AIDS response in Malawi, how will it look like? How should it look like from your perspective?
Okay, thank you very much, Christopher. I'm really privileged to be here, and it's such a great opportunity. 10 years from now, I would like to see a world free from AIDS-related illnesses and deaths amongst children, adults, and girls and young women, youth, especially the marginalized community. I would like to see donors, the government, still committed towards the AIDS response. I would like to see science improving in terms of HIV cure, vaccine, and we are really making progress since the coming in of the DDG and elimination of mother-to-child transmission of HIV. It's really giving us hope. Even the use of PEP and PrEP as one of HIV preventive measures. And I would also like the world to create an enabling environment to protect human rights for key populations without fear of reprisal. And also the AIDS response should address all inequalities leading to approaches that to end cultural barriers in access to services, gender-based violence, as well as ending of stigma and discrimination when it comes to people living with HIV and towards the marginalized community. I would like to see the civil society organizations also being supported in fight against the HIV response. Yeah, thank you.
Thanks a lot, Grace. That's great, and we'll come back to that later on, of course, to follow up. And in the meantime, I encourage audience online and in the room to post your questions. But until then, I continue with our panelists here. As we said, we will turn now to science, because if we imagine 10 years from now, it is very, very important. What can we expect in terms of new tools? We've seen amazing, developments over the last 30 years, something, beyond expectation. But to get back on track, we also know we will need new tools. Hendrik, what's your perspective? What do you expect in the next 10 years? What can we get potentially as new tools? Will there be a vaccine on the horizon? Will there be better treatment options, other tools that we can expect? What's your view? You're free to kind of speculate also a little bit, but based on a great experience.
How much time do I have? Well, first of all, let me also thank you. It's great that we actually have this session and have a focus on HIV/AIDS during this time. I think we have come, first of all, a long way in the discovery of HIV after 1981, and socially, scientifically, politically, but I'm convinced that with the current pace and effort, and I have to be blunt on this, I don't think we will get to the point of ending AIDS in 10 years. 10 years is a very short amount of time, and we will have still the same problem, the same discussions in 10 years from now. Of course, we will have broadened our toolbox in terms of prevention, in terms of therapies. But you can see how even the developed countries are struggling to getting to 90. We will not achieve this worldwide within 10 years. So, and I think the major obstacle we have is we are focusing not or far too little on prevention. And let me make 2 points on that. First of all, we have a broad prevention toolbox, but it's not accessible for everyone. And in particular now coming up injectables and new prevention methods, and they're getting better and better and better. Without prevention and having everyone, in particular also in sub-Saharan Africa, in developing countries, for young girls, adolescent girls who may not want to take a pill or PrEP or something like this, or have condom at hands, we need to have those tools for prevention accessible to everyone. Second, and I'm not an economist, but thinking about if we want to treat everyone, it costs between $10,000 to $14,000 a year to treat a person with HIV. And it's a cost we have to invest for the whole life of that person. So with 1.6 million or 1.7 million people getting infected every year, we are adding every year trillions to trying to end AIDS. So where is the upfront investment in better prevention methods, in vaccines? Even Germany is not really invested in finding an HIV vaccine, and most pharmaceutical companies are not working on HIV vaccines. So with the right political will, what we can see with COVID-19, we can have much more vaccines in a phase 3 trial. But we have only managed so far to have, in roughly 36, 37 years, we have only managed to have 8 vaccines in the phase 3 in HIV. For COVID-19, we had within a year 30 in the phase 3 clinical trial. So I think upfront investment into prevention, all methods of prevention, will actually save a lot of money.
So I know I'm pushing you a little bit, to speculate, but if you have to bet, what's the likelihood we will have an HIV vaccine in the next 10 years? And do the new technologies of mRNA, technology, do they offer, an increased chance of getting to a vaccine? What's your view?
I mean, in 10 years from now, I don't think we will be at the point that a vaccine can be deployed. But of course, we will be better in our understanding what we need to have a vaccine. And maybe we have a vaccine that kind of works a little bit better than the current ones we have. So the last vaccine trial failed, had an efficacy of 25%. We had before one with 31%. The mRNA technology offers really a unique new tool to quicker develop vaccines than we had before. But it had been tried in non-human primates in combination with other components. And there was a signal, there was a positive signal. So it might be a good way to try it out, but it's so hard to predict if a vaccine is going to work or not.
Right. I can't push you further on that. I can see. In the meantime, encourage the audience, send in your questions. Michelle, we will come to the Global Fund and so on later as well. But first, I wanted to ask you as well, as a scientist, you've been being a researcher as well on HIV for all the 40 years, basically, since, the discovery. What is your expectation? What can we expect from science? And it is not only vaccine. I mean, we are also looking at maybe improved ways of treatment or additional tools in prevention and so on. What's your assessment there? What we can expect?
Well, as Hendrik said, you're asking us to bet somehow on the future here. Let me say, I would bet on what we call a functional cure, maybe by 10 years from now. That is a cure that would allow people to enter in long remissions where they would stay without antiretroviral therapy. I doubt that we will reach what we call the sterilizing cure, with the full disappearance of the virus. And I share Hendrik's view on the vaccine. I also share Hendrik's view on the fact that we will make major progress in prevention tools, particularly, hopefully, for women and girls to protect themselves from high risk infection where they are. However, we will, whatever progress we will see, we will face, as Grace said, as Winnie said, as Hendrik said, these issues of access and fair distribution, to which we come back. Let me just add a few points to the discussion. And let me say, I agree 150% with Winnie. This is a time to have a reset. I also like the idea of thinking ahead, because if you think about it, one of the differences between the AIDS movement and, let's say, the climate change movement is that the climate change movement is looking forward, to the mid-long term. And we in the AIDS movement have always been focusing on the emergency response. And what I think our discussion is bringing today, and I'm really grateful to the organizers for that, is to help us think a little differently. And I won't repeat what has been said, but let me give maybe mention a few of the uncertainties that I can see in the coming 10 years. One is population growth. When we say we need to reduce the number of infections, it's as if we were starting from where we are now. But we will witness a huge demographic increase, particularly among young people, including in Africa, of course. And that will be a huge challenge for prevention, or for scaling up prevention, even if we have better tools. The other, and of course, uncertainty is climate change. and how will that evolve and possibly push millions of people into migration and conditions and circumstances that are circumstances we know are of vulnerability to HIV. And then two more sort of factors I'd like to put in. One, if you look at COVID-19 and what we experienced in the last few months, is the uncertainty linked to politics and to governance. We've seen in COVID-19, failures of governments. Think of how Brazil has managed COVID-19. Think now about how some of the more to the east of Germany, leaders are addressing the issue of vulnerable populations and rejecting tolerance towards same-sex relationship and people who use drugs. So we are at the mercy of those political failures and government failures, whatever effort we as an international community will be able to do. And finally, we will find, of course, major challenges in funding for health in general, particularly because in many low and middle income countries, the challenge will be with the demographic growth. And for our countries in the West, the challenge will be with the elderly population that is growing. So I think we have to enter all of those factors in how we think. But again, I'm very pleased to be in this panel with all of you. Greetings, Winnie, to you in Kampala. And I look forward to the discussion.
Great. Thanks a lot, everybody, for this first round. So I do believe we have probably the result of our first little poll, and if that could be projected. Before we then get to the second question. Very good. Do you see an important role for the global institutions such as UNAIDS and the Global Fund after 2030? Very clear, overwhelming majority, 91%, 9% say no. So great. Thank you very much for that very clear vote. And then we can also post the second question. In your opinion, what is the most important aspect in ending AIDS by 2030? So this is the second question. This requires a little bit more input in a few words that you can put on your cell phone or iPad, and then in about 20 minutes I will call on the results on this second question. I would, in the next round, still focusing on the panel, and I will come to all of you here in the audience also quickly. But I think the question of equity clearly came out. Winnie, you addressed that, and there are different aspects of that. There is the equity question. Have we reached all populations over the last 30 years, or are we seeing increasingly also pockets where programs reach the people pretty well? They have access to prevention, care, and treatment. Mortality from AIDS has gone down, but we also know there are still communities, regions that are not reached. And Grace, you will probably say something about Malawi, where in a country like Malawi, not everybody is reached in the same way. Michelle, you indicated, Eastern Europe, for example, we can talk about regions. There are big differences in the regions, and we will not end AIDS unless we address, these inequities, on both levels. There's also the aspect of equity, in terms of access to tools and new tools. You mentioned the question of price, Henrik. If we have new tools that are prohibitively expensive, then we will have another equity issue. And, I think we made great progress over the years in terms of reducing prices for ARVs and increasing access, but it remains a big challenge, as we also see from the COVID response. So if I may focus on that in my next round, Winnie, starting again with you. If you reflect on these two different equities, right? Are we reaching all populations in need with our programs? And also, you know, are we confident that we can make sure that, you know, all the tools that we have available and also future tools will be made available in an equitable way? What's your view on that?
Okay. In the two scenarios of achieving success that are before us, we need different responses, obviously. In one, I envisage a response that has matured and is integrated in fully resourced, efficient, effective public health systems, and that these systems work for all people without discrimination. But there are many ifs to get there. If we tackle the acute and intersecting inequalities that are obstructing progress, as we have put out in our new global AIDS strategy, if we meet the ambitious but really achievable targets for 2025 in all geographies and across all populations, if every country and every community gets back on track to end AIDS, fulfilling the commitments that are in the political declaration, if we can raise $29 billion and invest it annually by 2025 to meet the needs of the low and middle income countries, if global leaders, if the leaders of countries are smart enough to implement the roadmap and make the necessary changes, key changes in laws, in public policies, in tackling harmful social norms, in equalizing services, if leaders can do these things, then we can say that by 2031, people living with and affected by HIV will be living, working, learning, aging in peaceful and more equitable societies. Societies have to become more peaceful, more equitable for this to happen. They will be enjoying healthy lives and well-being, and they will also be fulfilling their own human potential. And then all this work we have done, the structures we have built that have helped to improve global capacity, these same structures can be then useful, or will be useful for preventing and responding to the next pandemic, because pandemics are not ending, they will always come. But whatever we have built will have made pandemic resilient communities, pandemic resilient countries, able to respond quickly, effectively, using good data, all those things we have put in place, multisectoral approaches, evidence-based approaches, human rights centered, community-led, all these things will be ready for the next pandemic. We can prevent other pandemics. This is my vision for 2031. You may ask the question, are we moving in that direction? In some ways, yes. We have some successes that encourage us and spur us on, but in other ways, not. I mean, do you feel that in these current discussions, for example, on pandemic preparedness, that the perspectives and role of communities, that human rights, that gender equality are strong in those conversations? Hardly. They're talking about governments having power, WHO going in to check and regulations, but these issues that matter to succeed, I don't see them at the heart of those discussions. Instead, we seem to be repeating the mistakes of the earlier response of HIV. So in some ways, I'm not optimistic because I'm not seeing the lessons being learned as we fight another pandemic. But on the other hand, I see that what has brought us here to put 3/4 of people living with HIV on treatment is real strategies that work, and we know them. And if we keep moving with them, we can achieve. So that is my answer, that I'm a pragmatic optimist.
I love that, Winnie. You know, I wish we were all pragmatic optimists. That's great. You know, before moving again to the panel, I will also read some questions from the audience because it relates to some of what we have already discussed. There is an interesting question asking which communities will be most affected by HIV post 2030. Grace, I will come to you on that, but also, you know, others are very welcome to comment on that. There were questions on our discussions on vaccine and functional cure. Hendrik, there's a question here that's asking which impact does mRNA vaccine technology have on HIV vaccination? You already kind of mentioned that somehow, but just want to make sure that we capture that. And on the functional cure, Michelle, as well, there was a question, you know, what role you see for that in the next 10 years. Also in terms of latency reversal, immunotherapy, and so on. Maybe it's a question that might go to both of you. And then there are a couple of questions more on the kind of institutional setup with UNAIDS and Global Fund that I will come to in the next round. But Grace, you know, maybe this question, you know, which communities do you still see mostly affected if you think of 10 years from now, you know, in Malawi, but also from what you're hearing from your, you know, activist colleagues from other countries?
I feel like adolescent girls and young women and key population will still be affected by the HIV pandemic if we don't invest more in them and come up with strong interventions. Because in Malawi, we have had a lot of increase in sexual violence and gender-based violence during this COVID-19 period. And in this process, some of the adolescent girls and young women have contracted HIV. So I feel like that's a very big group of people who need more interventions. Yeah.
Right. And Michelle, you know, I didn't mention that, but many know you have been for many years also been the special envoy, you know, for HIV/AIDS in Eastern Europe, Central Asia. And you alluded to that. We've all been very concerned about if you're looking at one region in the world, it is that region, you know, where we have seen rising rates of infections and other populations, you know, being particularly affected compared to Africa. Maybe you would like to comment on that.
Yeah. Thank you, Christoph. Yes, indeed. Not only it's a region that has seen increasing rates of incidence, but it continues to see increasing numbers of cases. So it is a big issue. You spoke a little earlier, Christoph, about pockets, yes? I have been saying, you know, one of the risks is that we enter in an endemic of small epidemics, yes? And that's, of course, where we have to put all our efforts and forces to break that possibility, to confront that possibility, not to let it go. I fully agree first with Grace, obviously, you know, gender violence will still be there in 2031. And it's really women and girls in Africa must be the #1 effort in prevention, in attention. And together with that, in other regions of the world, and here I'm talking specifically about Eastern Europe and Central Asia, but some parts of Asia, some parts of Latin America, and in some parts of the European Union, you know, we're still criminalizing HIV transmission in many countries. We're criminalizing people who use drugs. We're criminalizing same-sex relationships and practices. And that has to change. And that's why the UNAIDS strategy is so key there. The second point you raise is about access, equity in access. Let me just say, I think here we are at the breaking point. The models of the 2000s and of the Global Fund was a model designed in times of MDGs. Research and development will be in the West, basically, and then the G7 that created the Global Fund would make sure that money is available to redistribute those goods, the drugs, the preventative interventions to the South, and put up a wonderful mechanism that we can discuss later, the Global Fund. But that's not the world of 2021. And the COVID crisis has seen that that view of some people buying and then redistributing is just obsolete now. We have Russian vaccines, we have Chinese vaccines, we have Indian vaccines, we have Cuban vaccines. Research and development is not the privilege of the West. And of course, production and manufacturing has to be dealt with at local, let's say, regional or continental level, and Africa has paved the way there. So I think in terms of equity to access, COVID-19 is providing us with a unique opportunity to change the model.
That's right. Completely agree. I think there's a lot that the COVID response can learn from the HIV response, actually, but also
that's
the other way around as well. Henrik, you know, the questions about the science, but I also wanted to kind of ask you one question about Germany or Western Europe, you know, because we are looking globally here, and you mentioned that in your first statement. You know, it's not that, you know, every problem has been solved if you look at HIV in Germany or members of the European Union. Would you like to comment on that, how you see that, and also 10 years from now? After all, we are meeting in Germany here today.
Well, yeah, I mean, Germany is close to reaching the 90 finally, right?
Maybe they can go for 95.
Yeah, exactly. So it's for us, it's the first 90 that gives us problems. So to identify really everyone who is infected, that they can have access to treatment. So relating to the question that you were just asking, Grace, I totally agree with what Grace said, but we are currently also seeing a shift in the pandemic, in the HIV AIDS pandemic, towards low prevalence countries. And with rising infection in that region, and this is basically happening on the doorsteps, and Berlin often being referred to as the gate to the east, we are seeing in those countries an increase in new infection. And in all countries where we have stigma and discrimination in particular, but also where we have war, these are all drivers of new HIV infections, and at the end also more AIDS cases. So if we are not managing to also focus on those countries, and I think there's too little focus on Eastern European countries, on low prevalence countries, we will have a pandemic that we are just not going to be able to manage, because as Michel said already, we will have those pocket outbreaks where we hear too late about and know too little about.
Great, thank you. I will now turn a little bit more to the two institutions that have been leading on the kind of global HIV response, at least over the last 25 years. And we should ask ourselves also, you know, where would these institutions be in 2030? What needs to change, maybe to kind of make them fit, you know, for the year 2031? Turning first to you, Winnie. When UNAIDS was created in 1996, it was not just, you know, that a new UN agency was created to address HIV/AIDS. It was a real kind of innovation in the way that the UN system addressed the global pandemic. You know, the way how UNAIDS was bringing together all the other kind of UNAIDS partners, but also the way how UNAIDS, I would say, you know, maybe as a real pioneer, included, civil society, key affected populations in your operations, in your governance, and so on. So UNAIDS has been a real innovator, and I think there's a lot to be learned from that. But if you look at the next 10 years, how do you think, UNAIDS has to evolve, building on these innovations to be the organization that, will help us to kind of get towards the end of AIDS over the next 10 years? You're muted, I think, Winnie.
Thank you, Christoph. UNAIDS was established 25 years ago as a collective endeavor of several UN agencies. Today there are 11, aimed at ensuring a multi-sectoral and coordinated global AIDS response. UNAIDS became the first and remains the only UN organization where civil society is formally represented on its board. So it's a whole of society approach. The participation of civil society, represented by people living with HIV and other affected communities, opened a unique space to advance human rights issues, especially around sexual and reproductive rights in a UN context. It has helped to anchor the global AIDS response in the lived experiences of affected communities. Affected communities at the forefront of the AIDS response have helped to maintain a sense of urgency and to foster global solidarity, which then brings in the attention and the resources that we need to fight AIDS. This is an amazing story of the United Nations. HIV created a rights-based social movement that brought people living with HIV together with world leaders, with scientists, with governments, with communities to push for action to end the epidemic. I mean, these are things that now we kind of take for granted, but they were innovations. They were new, and they pushed this response to where it is today. Innovation, innovation, innovation. This partnership that was so broad brought about innovations in all aspects of the response, in the structures that were created, in the science, in the human rights arena, always innovation. Championing new ideas, new ways of working, new ways of delivering services. All this was always about pushing boundaries. And even the partnerships were themselves an innovation. It's Kofi Annan who said that the AIDS epidemic, which could have divided the world, in fact, united its people on an exceptional scale with exceptional results. Then came the creation of the Global Fund, 2001, also delivering exceptional results, ensuring that the Global Fund is fully resourced through its replenishment conferences, is also an innovation, and it's critical, and it must continue, not only for HIV, of course, for TB and malaria. UNAIDS and Global Fund continue complementing one another for 2 decades. Us as UNAIDS providing technical support to countries, ensuring strong engagement with civil society, strong political leadership. Thanks to our country presence, we are in 70 countries with 70% of our staff based in those countries. We help to make the Global Fund money work, stretch the dollar to reach the most in need. We've supported over 80% of the applications that relate to HIV results for the Global Fund in this last year. So our work on the ground is more critical than ever. The pandemic has created, this new pandemic, COVID-19, has created disruptions in service delivery, they are also exacerbated by lockdowns that don't take advantage of what we have learned, that trade human rights with health safety, instead of balancing the two. They block civil society's engagement, all this, and then an over-reliance on criminal laws during this pandemic. All these have pushed us back. But thanks to Germany and other governments, we've managed to push forward and use and even innovate more ways of delivering services, differentiated service delivery. We've innovated during this crisis. And by partnering with new institutions like Africa CDC, we are supporting communities to manage, to balance responding to HIV and to respond to COVID and to reach everybody. So again, optimistically, I see that our innovations have continued to be spurred on even by a new pandemic. They inform how we fight the next pandemic, and the partnership between us, Global Fund, WHO, and the other partners within the UN continue to deliver successes. So to answer your question, I see that as institutions, one, we must step up how we partner. I keep saying we must not be just a club of friends of 11 agencies who are just friends who meet for tea, but that we must be more tightly locked in as the UN with the Global Fund and deliver together, not deliver each our own separate bit. So there's need to take our partnership to the next level, but it has delivered. Thanks, Christoph.
Thanks a lot, Winnie. I think this is a clear kind of statement, also one that I think fits with our policy track. UNAIDS has been a very innovative organization, real innovation at that time, but probably it is time to look at how it works. With these 11 agencies, how closely can you coordinate? What kind of power you have, to kind of bring all the strength of these agencies to bear, for the fight against AIDS. I think there are some issues that need to be addressed over the next years. It addresses also a little bit the question that came from the audience. How would global coordination between UNAIDS and the Global Fund need to change to achieve an end of AIDS? Maybe that's something also we can look at from the country level. Grace, in a minute, how do you see these organizations cooperating? How could they coordinate maybe better? But I completely confirm also what Winnie said. UNAIDS has always played an indispensable role for the Global Fund, and we've both experienced that very much, Michelle, that without UNAIDS and the country presence, the Global Fund could not have been effective at the country level. There's a question here from the audience about do we need to change a little bit from the kind of verticality of these programs, and how should they be more integrated? So maybe that's also something that we can look at. But I would turn this time to you next, Michelle. You have not only been the executive director of the Global Fund from 2007 to 2012, but you've been involved with the Global Fund from the creation. I mean, you were in many different functions on the board and so on. So you've observed that from day one. And, knowing you, I would think you would also say the Global Fund has been an innovation in its own right, in many different ways, engaging the countries through the CCM, civil society, inclusion on the board, and so on. But you will also have observed that over time, what is your view? If you see the Global Fund in the next 10 years, how does the Global Fund need to change to remain innovative and to remain so relevant for the global response to HIV?
Well, thank you, Christoph. This is a difficult question in times where, as you say, vertical funds are questioned, and where I'm hearing very often we can't continue creating another fund every time we face another crisis.
And still, we often do it, right?
Yeah. My view is that we should really focus when thinking about the Global Fund in the future about what's the key innovative features of the Global Fund are. then whether the mandate remains what it is or is broadened to tuberculosis, to COVID-19, is not the issue to me now. The issue is to really preserve and promote three key elements of the Global Fund. One is the democratic or the multi-sectoral governance. The first fund where, at that time, and it was hugely innovative, of course, donors and so-called implementers were equally represented, and the person living with HIV, representing the people affected by the three diseases, would have the same right of vote on the board as the representative of the US that contributed over $1 billion a year to the fund. So that representation, both at the board level and at country level in the CCMs, so that decisions are made together involving all of the stakeholders, a key innovation in the system. The second innovation was the peer review by the technical review panel. So it isn't the decision of a donor or the decision of an institution, on whether we would fund a program or not. A program will be funded based on the fact that it has been peer reviewed by independent experts of the international community. That is absolutely key, and that really has shaped the ability of countries throughout the years to build programs that respond to the real advances in science and knowledge. And the third is performance-based funding. That is, funding is not, we provide money, or the international community brings money, and then let's see 3 years later, let's read a report on how that has been spent and what has been achieved. It is money that is being disbursed based on the results. Now, to me, these three key principles will stay, whatever the future of the fund is. Where I see needed changes, of course, is that we're not in the MDG era anymore. We're in the SDG era. We're not in a world with a rich north and a poor south. We're in a multipolar, geopolitically radically different world. We have new economic powers, we have emerging countries, we have huge progress in everywhere. We have an Africa that is so promising for the next few years. We have to shift from this sort of donor implementers scheme to a true partnership scheme of governance. It started at the Global Fund. And you, Christophe, have been contributing to this a lot, in changing the language. But we really have to accelerate that change and go more in depth into it. So to adapt that model to the reality of geopolitical governance and also the need for more regional empowerment. I don't know whether the future should always be in, Geneva organizations. I think when it comes to UNAIDS, when it comes to WHO, when it comes to Global Fund, when it comes, of course, to manufacturing and delivering, global public goods, we need to think much more regional in the future. So here are a few thoughts.
Thanks a lot, Michel. On many of these topics, I wished we had a few more hours to go so into that very kind of, important topics and questions. But Grace, asking that question to you, you're experiencing UNAIDS and Global Fund, on a daily basis in your country, Malawi. what has been your experience, with those institutions, how they operate, and is it adequate? What needs to change? Do they coordinate enough? Would you see a different type of approach from these organizations if you look at the next 10 years? What's your view on that?
For Global Fund and UNAIDS, they have really been accommodative when it comes to engaging young people. I remember I've been engaged in closed meetings with Winnie, as well as with Peter Sands. I'm in the Global Fund Youth Council board. So we usually interact with these two organizations and advise them on areas we feel like they need to be working with young people. And these two organizations, they have given power to our government and the CSOs to make independent decisions when it comes to funding. And this is really a very good intervention that they have really made. And I feel like even during funding request proposals, they make sure that there is a representation of young people so that they can contribute towards it. They can input what areas they feel like this organization needs to improve. So those are most important things that I feel like they're really doing good as these two organizations. For the areas that I feel like
do better, right?
Yeah. For the areas that I feel like they need to improve is for example, I can give an example of the Global Fund grant. In Malawi, interventions only goes to few districts, but when it comes to HIV, all young people in different districts are affected. So I feel like we need to scale up the interventions in maybe all the districts to ensure that we are reaching out to everyone and everyone is being supported. And I also feel like donors need to support youth-led organizations. We are really leaving them out. The donors always complain that youth organizations don't have capacity. So let's build their capacity so that they can own the grants and they can have the power to reach out to the marginalized community. And I also feel like they really need to support youth-led organizations like the Association of Young People Living with HIV and also the key population like the LGBTIQ team. They really need to support them with enough funding since they are really facing so many challenges in their country, the violence, they need our support. Thank you.
Thanks a lot, Grace. There's an interesting question from the audience that I would like to address to you, Hendrik, because I know you're working both on HIV, but also, COVID-19 quite a lot. And the question relates to the pandemic treaty. We know there's a lot of discussion about, a pandemic treaty. There will be sessions here today and tomorrow discussing that, the pros and cons, and, we will have a World Health Assembly later on this month to discuss that. And the question from the audience is, what difference would a pandemic treaty have made for the AIDS response 40 years ago? That's, of course, a hypothetical, a question, but maybe to get your view a little bit, not only, what would have happened 40 years ago if we had one, but, generally how, do you think this can be an important tool that could have helped us in the HIV response and can be very helpful in the future COVID response? What's your view on that?
Well, I think it's an important tool, the pandemic treaty, and in particular, as we are now realizing in the COVID-19 response, how badly we were actually prepared, even though we have the WHO, we have those organizations, but we have not been prepared really for the pandemic. It's not actually the fault of the WHO. They kept for quite a while that there's going to be a pandemic and we need to prepare for this. And I think a pandemic treaty would be an important tool and an important lesson to learn after the COVID-19 response. What I think for the HIV AIDS response, the problem we currently have is that we are in our communication, what HIV AIDS is, that we are actually sending two different messages, and that might be perceived confusing. On the one hand side, we rightfully are saying that a person who is HIV positive and is being treated has a normal life expectancy. and it's a chronic disease that you can live with, and so to reduce stigma and discrimination. But on the other hand, we want the world and the world community to focus on HIV and AIDS because it's a deadly disease. It's a deadly disease if it's not treated and people are getting infected and we cannot cure it. So we have a problem here because on the one hand side, oh, it's not, to make it blunt, it's not that serious. On the other hand, we are saying, well, it's really serious, and we are not really managing to putting both sides together. And if for UNAIDS and WHO, if we are not managing to really communicate that this is a serious topic we need more funding for, we need more focus on, we need more attention, we will not go very far beyond 2030, and we probably have the similar discussion. So I think it's also something UNAIDS needs to think about, how they are communicating this disease, because it's we are in a kind of in a dilemma here, because for the people who are HIV positive, we want to have the communication. There is no stigma, can't be a stigma, and there can't be discrimination, but we need to also focus how serious it is.
Yeah. Christoph, can I just add something here? One of the things HIV has achieved is a special session of the UN General Assembly.
Mm-hmm.
And that
regularly
was
now.
Regularly
now, even.
Absolutely.
Yeah.
One is the first one,
Yep.
and the first resolution of the Security Council on an issue that was not war and peace, but a disease.
Mm.
And that session really brought the commitment of the entire world to fight that epidemic.
Yeah.
And then the second achievement is indeed, as you say, that every 5 years, the world comes together and reviews where it stands, the progress made, the remaining challenges. And basically, there is an accountability to itself of the international community. And this is something we have not yet achieved with COVID-19. Right. And whatever discussions we have on the treaty, I know this is not the topic of this session, but I really think we need that General Assembly. We need that global commitment. I don't understand that it hasn't happened yet. And then we need that accountability on the progress.
Absolutely. Winnie, I will come to you. Immediately with that. I know I'm a little bit overdue with the answers to the second question that we posed. So maybe we can show the results to that, and then I come to you, Winnie. And I think this was an important point, Michelle. So, in your opinion, what is the most important aspect in ending AIDS by 2030? So, sorry?
No, I'm reading this.
Yeah. So, and I think this is a little bit of a, prioritization, right? I mean, you see the kind of most common answer, at the center. So prevention, equity that we discussed, education, which we have not mentioned, political will, and that's maybe something we can come back in the final round a bit, because so much depends on political will. We've discussed the vaccines, the options here, but also heard a little bit about skepticism for the next 10 years. As far as I can remember, HIV vaccine was always 10 years away from the beginning, and still is. And there are many other points, of course, that are very important. We haven't, gone into funding investments, and time will probably not allow to go much more into that. But obviously, and if you know me a little bit, then you would know that I find this a very important, topic for the international HIV response. And we talked about research and the importance of research and the global equity, because this is not just a kind of question of equity in the HIV response. This has to do with global equity and the need to reduce global equity. So very important points here, but maybe then we use the final round before we come to a conclusion to talk a little bit about the political will, and you alluded to that, Michelle. The political will that was there 20 years from now for Kofi Annan to invite for an HIV UN General Assembly special session on AIDS, and then UNAIDS leading that, introducing that really in the UN system of having the regular high-level meetings, which was a real kind of achievement, and I would say innovation as well. And without that, we will not be able to kind of take forward this fight against HIV/AIDS over the next 10 years. So, Winnie, first to you. What's your observation of what you sense in terms of the political environment, let's say, that you observe, and also what is your wish, what is your vision for the next 10 years on that?
Thank you, Christoph. From the outset, the AIDS response was conceptualized as more than a health issue. In fact, in the beginning, WHO was leading, but its approach was considered too biomedical. HIV, the pandemic, was seen as more than just a health issue, and that's what a pandemic is. It becomes an economic issue, it's a political issue, it's a legal issue, it's a financial issue, it's many, many things. So, but then because HIV was framed as a rights issue, it generated action and accountability and engagement. And community, then the issue was about how do you get communities protect themselves to survive. It became about people exercising their human rights. I think that the AIDS community and communities that are affected will continue paving the way forward using rights-based approaches. This is what is key. This is what must remain. We have been a pathfinder, creating structural change and pushing for transformation in society. That must remain. We, as a partnership, I'm not talking just as UNAIDS, as a joint partnership, we shine the spotlight in the dark corners of society. It's very special about us within the UN. We reach out to, we stand in solidarity with those who are stigmatized, who are marginalized, who are criminalized. We assert with them their rights. This is very special about us in the UN system, and that must continue. Those are the things that make us relevant way beyond even when the pandemic has ended. Creating spaces for voices to be heard. Look at whom you have on your platform, a young woman living with HIV. This is unique. This is powerful. That those who are affected speak for themselves. It causes a shift in power. She sits with the scientists, the top HIV scientists. Both their voices are valid. So this is a shift in power. We must continue decolonizing global health. This is a challenge for us, that solutions can't come from one part of the world for other parts of the world. We are part of decolonizing global health by actually raising and shifting power towards those who are affected and who may not have financial and political power. So we also nurture and build leadership, effective leadership. This is part of what we do, that from the communities, we build those leaders who lead their communities. That is part of success, and that must continue. We support civil society to perform a range of functions, from delivering community-led services themselves to monitoring and holding service providers accountable, to campaigning for equity in access to medicines, and so on and so on. This support civil society is key for solutions to come. Enabling people to access and use quality data for their strategies. This is special about us, and this must continue. And these are the things that you bring into fighting new pandemics and succeeding. gathering the data and making it available for all to use. So I see that UNAIDS, the joint partnership, has been a lot about pushing the boundaries of what and pushing for reform within global health. In global health, we are so many actors, we are crowded there. And in that crowding, often we don't have coherence, we pull in different directions, we contradict each other. But we, as a small part of the global health architecture, we've brought in the element of being coordinated, of crowding in the voices of those who are affected, and of innovating together. So I see us as a force for change, for reform within the global health architecture, for a future where health systems deliver for all people and prevent. And I didn't vote, but I was part of that response on the prevention. It is the key. And we have what it takes for that to happen.
Yeah. Thank you. Thanks a lot, Winnie. You're right. You know, prevention was mentioned there. I don't think we have focused maybe enough on prevention in this panel. And by now, I also have to remind the panelists, now we have to be pretty brief so that we can, you know, come to a summary in a minute. But I want still kind of to ask you and, you know, question each, but with really brief comments. Grace, when we met yesterday, we discussed also about domestic resources, you know, what Malawi, for example, other countries would contribute over the next 10 years. That relates also to the question of political will, because it's also a question about political will at the country level. Briefly, how do you assess that? You know, is the political will there? Also, you know, in Malawi, for example, to invest more so that Malawi can, you know, become more self-sufficient over the next 10 years? What's your view?
For Malawi, currently, I feel like we need a resilient and sustainable system for health that can, and a robust investment towards HIV, including investing in the community organization. And I feel like we also need a high-level political commitment and leadership. And we also need an active engagement of CSOs we need an active engagement of civil society organizations as equal partners and not just as mere recipients of funding. And we also need an investment in HYW programs to ensure that they are enrolled in retention of schools and completion of secondary and tertiary education. And we need research to generate on what works for our country and what needs to be abandoned. And we also need a commitment of our partners that can gain and fragile despite what will our government do, or we cannot do it on our own as a country. So we feel like we need more partners to end HIV in the next 10 years.
Mm-hmm. Yeah. Thank you. Michelle, I have a question that the audience said is a provocative question, so I think it's right to address that to you, which is, would ending AIDS means ending UNAIDS too?
I think UNAIDS has to be there until the end of AIDS. So the answer to me is clear. When AIDS will have ended, UNAIDS has to end, because the mission of UNAIDS is so focused. As Winnie said earlier, the very sort of heart of UNAIDS is bringing the effort, the multi-sectoral effort of all agencies, or 11 UN agencies, onto one goal, ending AIDS, each one bringing its own specificity and capacities. So to me, UNAIDS has to stay until we see the end of AIDS.
Right.
Whether UNAIDS will also expand in its mandate, as I said earlier, to TB, COVID, this may be there. But when it comes to AIDS, that's my answer.
Right. Yeah. That's again something that would require another 2 hours to discuss probably. But Hendrik, a question to you. Back to where we are. You know, we are meeting in Berlin. We know there is going to be a change of government very soon. We heard in the introductory statement also from Winnie the very important role that Germany has played in the fight against AIDS, in the support to UNAIDS and Global Fund. You know, is really kind of an essential, partner and has been a leader in global health. And that relates also to the question of political will. So what do you think? Can we count on Germany also in the future to play this kind of champion role in global health for organizations like UNAIDS, Global Fund, and others? I know it's a bit speculation, but it's also the question, what can be done maybe to kind of make sure that this will be the case?
Well, first of all, I guess we have to applaud Germany how much they are funding UNAIDS and are committed to global health in general. And that's really thanks to the Ministry of Health and the Chancellery which we currently still have. But as you all know, we will have a change in government. So I very much hope that Germany will continue its effort, that we will even maybe ramp up the effort in the fight against HIV and AIDS. What Germany is lacking, and it's actually on the research side. Germany is putting very little funding into research for an HIV vaccine for an HIV vaccine. A couple of years ago, I approached the Ministry of Education and Research in Germany and asked them why they're not funding HIV vaccine research. And they said, oh, no, we do. We give $500,000 a year to the EU for that. So there you can see that the effort is very great from Germany's side in UNAIDS and global health aspects, but in the research side, and we have good researchers in Germany for this, we are not focusing on HIV vaccine, which is a pity.
Thanks a lot. I will only make a very brief summary before handing back to you, to close the session, and I will not try even kind of to summarize the very rich discussion that we had. But I want to take my clue from your statement, Winnie. Sure, Winnie.
Just one sentence.
Yes.
To agree very much with Michelle, that if we end AIDS, then UNAIDS should get a Nobel Peace Prize, we pack our bags and we go home.
Absolutely. I'm not sure he said that, but I completely agree, that UNAIDS should then get the Nobel Peace Prize. But maybe there would be a different role for UNAIDS then, because I'm sure, we have enough work to do in global health and on pandemics, even if we end AIDS. But I wanted to kind of take the clue really from Winnie's opening statement. I think, if I was to summarize the discussion, I would agree with, I would also be a pragmatic optimist. We know there are many challenges, inequities, challenges of finance and shifting priorities and so on. And still, I think we've also heard a lot of, things where we've seen positive developments over the last kind of decades, not the least facilitated through UNAIDS and the Global Fund and other international organizations. And so, we need to continue with that. We need to increase the community engagement that we talked about. We need to increase to kind of be very targeted on areas where we know we are not reaching the vulnerable populations, be it geographically or particular groups, and we need to redouble our efforts there. We have kind of cautious hopes also for innovations in science and development, and whether it is really a kind of full vaccine, but maybe depending a little bit on which efficacy we will reach, but it could become an additional tool, the functional cure that Michelle talked about. So I'm fairly confident over the next 10 years we will have additional tools that will help us accelerate the move towards ending AIDS. And we then have to make sure that these tools really reach the people most in need. But I do believe that we basically also have these kind of structures in place that will allow that with UNAIDS and with the Global Fund. Both organizations have this challenge that they kind of have to reinvent themselves a little bit, also in the context of this pandemic, which is happening in a sense. I mean, Winnie, you have been an outspoken advocate for people's vaccine, for example, that clearly goes beyond AIDS, but, using the platform of UNAIDS, being a global advocate for health in general and for reducing inequities. We know the Global Fund has been strongly engaged in the kind of COVID response. funding many different aspects of therapeutics, diagnostics, protective equipment, and we'll have now to decide, in a sense, how much they want to go in that direction. That will be an important question for the board meeting 2 weeks from now. But I have no doubt that the Global Fund will play a very important role in this pandemic and in the global response to future pandemics. So I think that's my kind of summary of this discussion, and on many different topics I would have liked to go more in depth, but that is not for a 1.5 session at the World Health Summit, but certainly for conversations that should continue. Thank you so much for your participation. I hope I did justice to the questions that I got here, and helping us to finish almost in time. And with that, I'm happy to hand back to you, Mr. Zubair.
Thank you. Thank you very much, Christoph. Thank you, dear panel. Thank you, Winnie. Thank you, Grace. Thank you, Michelle. And thank you, Hendrik and Christoph, for this very compelling and rich discussion. Thank you all here in the audience as well for your contributions, also in making this discussion a very lively one and a very interesting one to all of us. We heard a lot about what was said today. We talked about innovation and response. We talked about innovation and science. We talked about the many phases of inequities and how to curb inequities. We talked about it's time to reset, and we talked how we have to rethink the pandemic and how we can actually increase access to prevention. But let me also say that we talked a lot about the ifs, and let not the ifs be the evil of the good. All these ifs, my wish for the post-2030 era is that we do not have to say, if we have enough funding, if the world comes together, we can actually eradicate and eliminate the HIV and AIDS pandemic. It's time to act as now. And here at the Ministry of Health, we are here to actually take your views and design future health policies, and also intensify global partnerships with UNAIDS, with WHO, with the Global Fund, actually to promote, actually to achieve the goal even before 2030. As you know, Germany is a big supporter of UNAIDS. It's a big supporter of the WHO. I think money is not the issue, but it's also clear that Germany cannot do it by themselves. We need other governments to step up. We need civil society. We need everybody everybody to help us so that we can actually reach the finishing line, and we're just short of it. Thank you very much for your attention. Thank you for coming. Wish you all a good day, and have a nice next policy session. Thank you very much.